Congratulations on taking the first step in your child's clubfoot treatment. This video will help you understand how your child's clubfoot can be treated and how you can help your child get better. Clubfoot develops before birth and can appear in one or both of a baby's feet. The tendons in the foot and calf are shortened and tightened, resulting in the foot turned inward and upward and the heel up high. Clubfoot is not caused by anything the mother does while she is pregnant. A lot of parents feel guilty when they learn about their child's clubfoot. Clubfoot is no one's fault. There is nothing you could have done to prevent your baby from having clubfoot. It is simply something that happened and it can be fixed. The exact cause of clubfoot is unknown, but we do know that it is more likely if someone in your family has clubfoot. Clubfoot occurs in 1 in every 1,000 births across the world, and it doesn't matter where you live. Anyone can be born with it. Sometimes you may feel like your child is the only one with clubfoot, but in fact, there are 200,000 children with clubfoot living all over the world. The good news is that your child's clubfoot is treatable. Although you may be worried now, after treatment, you will see that your child is able to walk and play like other children. Don't worry, your child can grow into a happy and mobile child during and after receiving treatment. In order for clubfoot to be treated, it must be done by a clinician with your help. It is important for parents to complete the treatment process, including the bracing period. Treating your child's clubfoot will allow them to walk correctly without pain later in life. In the past, the only option was surgery, but now clubfoot can be treated using the Ponseti Method, which has a success rate of 95% and will not cause your child pain or discomfort as they grow. The Ponseti treatment method uses a series of full-leg plaster casts and foot braces to straighten out your child's foot. Most children will wear 5 to 7 plaster casts, but some will wear less or more depending on severity of clubfoot. After the casts are finished, most children will wear a shoe brace 23 hours a day for 3 months, and then while they sleep for 4 to 5 years. About 90% of children receive a small cut in their tendon behind their ankle during the final phase of casting. This is not a major procedure and not more painful than a prick. Although there are different ways to treat clubfoot, the Ponseti method of treatment is the best in the world and is the safest, most used clubfoot treatment method. Unlike surgery, which has many painful side effects, the Ponseti method allows children born with clubfoot to have a normal life. Your child should be able to walk, run, and play sports with other kids shortly after they start treatment and have no painful side effects after they complete treatment. In fact, several professional athletes were born with clubfoot. The first phase of clubfoot treatment is the casting phase. This phase will slowly move your baby's foot so that it will grow in the correct position. With each cast, you will be able to see your child's foot get straighter and straighter. By the end of the casting phase, the foot may look like it is turned outwards. This is normal and expected as the goal of treatment is to overcorrect the clubfoot deformity. Most children have 5 to 7 plaster casts, which are put on each week by the treatment team. You can expect minor discomfort during the first couple of days, but your child should not be in pain during the treatment process. Your baby simply needs to get used to wearing the casts. It is very important to keep the cast on unless your clinician tells you otherwise. Do not take the cast off on your own. Each cast will be worn for 5 to 7 days. Call your clinician if your child's toes are swollen or very cold, if there is a rash around the cast, if the cast is soft, wet, or cracked, if the toes disappear into the cast, or if you notice a bad smell inside the cast. It is important to keep the cast clean and dry. Never put water on or in the cast. Do not put soap, powder, or lotion inside of the cast. To bathe your child, place them on a towel on a dry surface. Rub soap on your baby, then use a damp cloth to rinse. The cast can be wiped with a slightly damp cloth if it is dirty. Make sure your baby's diaper does not go over the cast. Change their diaper frequently to avoid urine or soil getting on the cast. Before your child's last cast is worn, they will likely need to have a tenotomy. This is a common procedure that is needed when the tendon is not long enough. About 85 to 90% of children with clubfoot receive a tenotomy. It allows the tendon to grow correctly. A tenotomy is a small cut in your child's tendon at the back of the ankle. Once the tenotomy is performed, your child's tendon will grow longer. This allows your child's foot to stretch to the correct position and for the heel to drop down so that your child can stand. Your child will have local or general anesthesia during the tenotomy, so they will not feel any pain. Most babies cry during the tenotomy, but it is not because they're in pain. It is likely because they are in a situation that is not normal to them. The discomfort of this procedure is similar to the pain of getting an ear pierced. After the casts and tenotomy, your child's feet will look straight. But don't be fooled, treatment is not complete. Think of straightening a clubfoot like straightening a bent tree. If you correct it while it is young and brace the tree so that it is straight as it grows, it will eventually continue to grow straight by itself. This is the same for a clubfoot. The only way to make sure your child's feet stay straight for the rest of their lives is by ensuring that they wear their shoe brace until they are 4 to 5 years old. The shoe brace maintains the corrected position. Your child must wear the shoe brace every day or the foot will gradually go back to the clubfoot stage. Within a matter of weeks, a straight foot will turn inward again and your child will have to start treatment all over or even have surgery. Bracing is an important part of the clubfoot treatment. It must be done in order to ensure that your child's clubfoot is treated correctly. Be sure to have your child wear the brace until your treatment team says it's okay. Even if their feet appear to be normal, they need to be kept in place and are at a high risk for relapsing. Over 90% of babies who do not wear their brace regularly during the first year, and over half of children who stop wearing their brace in the first 2 years, will relapse and have to redo treatment or get surgery. Experts have determined that in order to have a 95% success rate, the shoe brace must be worn regularly for 4 to 5 years. When putting the brace on your baby, make sure the heels are firmly placed in the shoe by pulling up and down on the lower leg. Use the hole at the heel of the brace to see that the heel is all the way back and not moving up and down or back and forth. If the foot moves forwards and backwards, the heel is not down, and you will need to retighten the shoes. If your baby kicks when putting the brace on, try to put the better foot in first, as they will likely kick more when trying to put on the second shoe. You can expect your child to fuss for the first week of wearing the brace. This is not because they are in pain. It is because the brace is different than what they are used to. Don't give up. Your child will get used to it quickly as long as you stay consistent. Your child should be able to crawl, stand, kick, and do other movements while wearing the brace. You can teach them how to swing their legs and move when they are getting used to the brace. Holding and playing with your child while they are in the brace will help them relax. If your baby gets blisters or rashes from his new brace, do not use lotion or oil to help heal the skin. They will make the problem worse. If there are bright red spots or blisters in your child's foot, it is likely that the shoe brace is not being worn tightly enough. Make sure that your child's heel is down in the shoe and that the shoe does not rub up and down on their heel when being worn. It is best to have your child wear thin cotton socks under the brace to help avoid blisters and redness. During the first phase of bracing, most parents use the 1 hour when it is not necessary to wear the brace to bathe their child. Be sure your child's feet are dry before putting the brace back on. When your child starts wearing the brace during nap time and nighttime only, the brace should be part of your routine. Getting used to wearing it while they are asleep will make them less likely to fuss when it is time to put the brace on. Sometimes a pleasant distraction can help calm your child while you put on their shoe brace. Try playing music, reading a book, singing a song, or feeding your child a snack while you put their shoe brace on. Some parents find it helpful to have a friend or family member help by holding the child while the brace is put on. Your treatment team may teach you helpful exercises and stretches for your baby. It is important to follow their instructions. Although many parents feel guilty when they learn that their child has clubfoot, there is nothing to feel bad about. This is no one's fault, and through the Ponseti Method of Treatment, you will be able to help your child be able to walk without pain in the future. When treated as a baby, your child will have no memory of the treatment process. When the treatment process is followed exactly as your treatment team instructs, your child will live a completely normal life. They will be able to walk, run, and play sports like any other child, and when they grow up, they will go to school, marry, and work without any difficulties from clubfoot.